Hi, my name is Leslie, and today I'm going to be showing you how to brush and floss. I'm going to be using my Typodont here, and I just have a regular manual brush I'm going to be using. Make sure that your brush has soft bristles. Hard bristles can actually cause trauma to your gum line. Don't want to do that, so always get soft and try to get the end-rounded filaments as well. So for the toothbrushing method I'm using today, it's going to be the bass method. And for that, you want to make sure to hold your brush at a 45-degree angle. It's going to be between the tooth and the gum line. And you want to just use a vibratory motion for that. You want to hold your brush on the same spot for at least 10 seconds, and then you can move on to the next teeth. So most people only brush their teeth for about 30 seconds, but you actually want to make sure that you're brushing your teeth for at least 2 to 4 minutes. You can use a timer to see how long that you've been doing it, because sometimes it seems like it's a lot longer than that actually is. Also, some electronic toothbrushes have a timer in them, and they will let you know when to stop, so that's a pretty neat feature to look for. You also want to make sure to get on the inside of the teeth. I'm gonna brush in there too with the same method. Always go on the inside of the teeth. Do not want to skip this area. It is very important. And this method could be a little more difficult for getting on the inside of these front teeth since it's such a small area. So if you can't do that, that's okay. You can just do an up and down motion like that. That's going to do a good job as well. You want to make sure to get the occlusal areas. So for the occlusal areas, you can do a short, quick motion like that. Or you can do little circles, or a combination of the two. But you don't want to press too hard, because you're not going to get as good at the cleaning. The little bristles will splay out to the sides, and it doesn't clean the occlusal surface as well. But you want to make sure that you're brushing 2 times a day at least, especially before bed. So you don't want to go to bed with all that plaque and bacteria on your teeth. You want to go to bed with clean teeth each time. So everything that I just did to the bottom portion, you would do to the top, and you can pick whatever sequence works for you. So brushing has gotten off most of the plaque, but the toothbrush is not very good at getting between the teeth. So you're going to need to use floss to get between the teeth. There's all different kinds of floss you can use. This is just a tape floss that I'm using. It's flatter than the round one. And you're going to hold it at your shoulder and bring your arm out like that. And that should be the right amount that you're going to need. So the correct way to floss is you want to wrap it around your middle finger. So you're going to take your dominant middle finger, you're going to wrap it around about twice, 2-3 times, and for the other middle finger, you're going to wrap it around a couple times. You can take a little more if you need it. And then you will use your pointer finger and your thumb to hold that floss. So you want to do a sawing motion to get between the teeth, like that. And then you're going to make a little C shape with the floss, and you're going to do that little C shape and slide up and down the tooth. Once that surface feels clean, I'm going to do the other side. Do again a little C shape, and you'll move up and down the tooth. When you're ready to move to the next teeth, you'll do the sawing motion to get it out. And then you want to always use a clean piece of floss for between each teeth. So you're going to wrap it around that part you just used and get a new piece. And you'll do the same thing. Do a sawing motion. Use a C shape to go up and down that tooth. And then you'll do the other side, a little C shape. And then a sawing motion out. You don't want to snap it in there like that, because you can cause trauma to your gums that way. You don't want cuts on your gums, and also it's just not getting a very good cleaning around the tooth. You want to make sure you're doing that C shape so that you're scraping all the plaque off the surface. And you want to do this to all the teeth. Just like brushing, this should be done 2 times a day. So with the brushing being about 2 minutes, and if you're spending about 2-3 minutes on flossing, that's going to be about 5 minutes each time that you're going to be brushing and flossing. 2 times a day, that's 10 minutes of time that you're dedicating to your oral hygiene. So it's really not that much time. It seems like a lot in the moment because usually we're in a rush in the morning and trying to get places, but spend some time working on it and it'll make all the difference in your health. Thank you for watching.